system? What is a skeletal system?
Skeleton.
Skeleton, yes. What is that?
Bones.
Bones, okay. Joints, very good.
Cartilage.
Muscles, yes. Musculoskeletal is muscles as well.
Ligaments and tendons.
How many skeletal systems are there in the body?
Two.
How would you classify them?
Two.
Now you're surprised, huh?
Maybe muscle and bone.
No, only the bones.
Axial.
Axial and appendicular. What is axial skeleton?
Skeleton.
In the axis.
Yes.
Simple. And the axis. What is that?
Skeleton.
Cranium, vertebral column, sternum, ribs. And what is appendicular? Limbs and the girdles. The shoulder girdle, the hip girdle, lower limb, upper limb. So they are the appendicular skeletal. So we talk about, is that okay or light? Is that okay or? It's good. Okay. So a little bit tricky lecture, so I need your attention here, and it's a little bit longer as well. I cannot say that few slides are explainable, others are on the text. In this class, most of them are very important, and little bit understanding is needed. Okay, so I need your attention there. So skeletal system develops from mesodermal and neurocranial cells. Mesodermal, the connective tissues, the mesoderm. You know about the layers of the germ layers, ectoderm, mesoderm and endoderm. So I'm not going into much detail of the neurocranial cells, just mostly it is in the mesoderm. As the notochord and neural tube forms, embryonic mesoderm on each side of them proliferates, form a thick longitudinal columns of paraxial mesoderm. Did you understand anything here? Yes. What did you understand?
It's stuff from notochord.
Notochord. What is notochord?
Notochord is
Yes.
crystal, between the mesoderm.
Between the vertebral. No. This is the future of the notochord actually. Okay. In the initial stages of development, a rod-like structure is developed. A rod-like structure is developed in the embryo during the 4th week, and this rod-like structure supports the embryo. What supports your body at this stage? The vertebral column. Why? That's why we are straight, isn't it? So if there is no vertebral body, what supports you? Nothing, isn't it? Similarly, at this stage, 4th week, there is no vertebral bodies. So notochord, a structure is there. When vertebral bodies grow around this notochord we don't need it, isn't it? Once the bone is developed, we don't need the other structure. So notochord is the initial structure which develops in the early stages of development. Vertebral column, it develops around the notochord. When vertebral column, vertebral bodies, vertebrae, they develop, notochord is degenerated. A small portion of notochord remains there. What is that? I will talk about this. Okay. So this is the structure of notochord. So embryonic mesoderm on each side of the notochord. Just remember this is a detailed thing. Embryonic mesoderm, the area which forms the bones, mesoderm. It thickens on each side of the notochord. There is a notochord in the midline. Okay. In place of just imagine vertebrae, there is a rod-like structure. On both sides of this rod-like structure, mesoderm increases, bands of mesoderm, they appear. If I show it to you like this is the area where vertebral column will be formed, isn't it? Around notochord. Okay. Notochord is not seen here in this picture, but you can see these are the mesodermal area.
What is the neural cord?
It is not in this picture. Later on, I'll show you the notochord. Notochord, not neural cord. Maybe in some picture later on. I don't know. If you see in this picture in the midline, this area where notochord is present actually, this black line. Okay. On both sides of this black line, you may see thickened area of mesoderm. These are the thickened area of mesoderm. This thickened area of the mesoderm, it is cut into slices later on. These slices are named as somites. Somites. You see these blocks? These are made up of mesoderm and they are known as somites.
More than 33.
It's maybe 44. So it depends on the time period. During initial days it is 3 pairs. After 1 week it is like 6 pairs. In 33 days or 20 to 30 days, 33 pairs. So they are on both sides of the notochord. Okay. This structure will make the vertebral column. This structure will make the vertebral column. How it will make, we will talk about this later on. It's crazy. This mesoderm changes, differentiates and begins to divide into cube. Cuboidal means cube-like structure. Cube, the ice cubes we have, right? You saw the somite, they look like ice cubes, isn't it? Cube-like structures which are known as somites by the end of the 3rd week. These blocks or cubes of mesoderm are located on each side of the neural tube which forms the spinal cord, okay. So on either side of the spinal cord they are present. Now your answer to your question, 42 to 44 pairs of somites formed during the somite period of human development, 20 to 30 days. These somites can be seen by ultrasound. So in the initial stage of the development, by counting these blocks, we can tell the age of the embryo. For example, in this slide is 42 to 44 pairs between 20 to 30 days. If we see 40 pairs, well, this is around 20 days. If we see 35 pairs, well, this is approximate, not exactly 18 days. If there are 25 pairs, well, it is 14 days. So this can be known by the number of the somites. Now, let's take one somite, one block, one cube. This one, okay, take it out. How it is from inside? What structures are made from this somite? What is a somite? Each somite differentiates into 2 parts. This somite has 2 parts. One is ventromedial, another is dorsolateral. Can you imagine what I'm talking about? Ventral, anteromedial, like this. Another is dorsolateral, like this, right? Ventromedial part is sclerotome. Remember this name. Ventromedial part is sclerotome. This cell forms the vertebrae and ribs. This portion of the somite, it will form vertebral column and rib. Oops. Another dorsolateral part, its name is, read. Dermomyotome. What it makes? Dermo, it forms the skin. Myotome, now you know. Somite has 2 portions, ventromedial, dorsolateral. Ventromedial is known as sclerotome, okay. What is formed from the sclerotome? Vertebral column. Dorsolateral is known as dermomyotome. Dermo portion forms the skin. Myotome forms the muscle. Clear? Very good. This is somite, okay? Ventromedial, sclerotome, dorsolateral, myotome, and dermatome. Dermomyotome. Then when we talk about muscle and skin, we divide this dermomyotome into two portions, myotome and dermatome later on. But still at this stage, just remember sclerotome, okay? Axial skeleton, I already told you, includes what? Axis, the area of the bones which is in axis. Axis means in the midline. Cranium, sternum, ribs, vertebral column. This is axial skeleton. Cranium develops from connective tissue around the developing brain. Now brain has started develop. So this cranium is a protective layer of the brain. It starts to develop around the brain. By connective tissue, the cranium consists of two portions. This cranium, it consists of two portions. What are those? Neurocranium and viscerocranium. What comes in your mind? Neurocranium. Brain. So the area which covers the brain, it is neurocranium. Viscerocranium. Slick. What is that? Clear? Cranium developed into two portions. Neurocranium. This all is cranium. This is all skull, isn't it? Neurocranium, nervous system covers the brain. The cranium which covers the brain, neurocranium. The cranium which forms bones of the face, viscerocranium. Now you need to revise the lecture in the camera, right? Later on. But it is clear, huh? Very good. Neurocranium is most conveniently divided into two portions. Again, the membranous part consisting of the flat bones which surround the brain and the wall, the cartilaginous part of the chondrocranium which forms the bones of the base of the skull. Again, there were two portions, neurocranium and viscerocranium. Forget about viscerocranium. Let's talk about neurocranium only. Again, neurocranium divides into two. The portion of bones, the membranous bones, this which covers the brain. And there is another portion on which brain is sitting on, the base of the skull. Have you seen the base of the skull? So this neurocranium we divide into two portions. The one which are these bones, parietal bone, frontal bone, occipital bone. And the next portion, base of the skull on which brain sits. Got my point? Ask me. Base of the skull on which brain sits. Go from here. There is a base. Your brain is sitting on something, isn't it? What is that? I'll show you. These are the bones. This is this covering, right? Membranous part. This is base of the brain on which brain sits. This brain, base of the brain, multiple bones, they start to develop, they fuse together. They fuse together, collectively they form the base of the brain, base of the skull. Got my point? cranium. Neurocranium, viscerocranium. Forget about viscerocranium. Neurocranium, two portions. The one which covers the brain, the other on which brain sits, base of the skull. Simple, isn't it?
Yes.
Clear. Very good. If you understand this, these 5-6 slides are a story. The membranous part consists of the flat bones which surround the brain is the vault. The cartilaginous part or chondrocranium which forms the base of the skull. Okay. Membranous portion of the skull is derived from neural crest cells and mesoderm. Connective tissue from, whenever I read the term mesenchyme, I'll say connective tissue, not to get you confused. Connective tissue is derived from the mesoderm, right? From these two sources invests the brain and undergoes intramembranous ossification. The result is formation of the number of flat membranous bones. Flat, these are flat bones, isn't it? Number of flat bones, parietal, frontal, occipital. But now you feel this is a one bone, isn't it? This is not one bone. Multiple bones, they fuse together to form a one bone, to appear a one bone, but it is not a one bone. This is parietal bone, this is temporal bone, this is parietal bone, this is frontal bone, this is occipital bone. When the baby is born, these bones, these bones are not fused. They appear like this. Why?
To allow the overlap during that.
You know that, huh?
Yes.
Because when the baby is born, the birth canal is narrow, isn't it? Baby has to squeeze out of the birth canal. These bones and brains are soft. Either they damage the birth canal of the mother, or if this skull is broken, it may damage the brain of the baby, isn't it? So during the time of birth, a procedure we call it molding. What we call molding. These two parietal bones, one bone come over the other during the time of the birth. By this way, it protects to damage the birth canal, it protects damage to the bone, it protects damage to the brain, and gradually, when the baby is born, this start to fuse, it will take time. These two large openings, this is large opening, this is large opening, we call them fontanelle. This is anterior fontanelle, this is posterior fontanelle. The posterior fontanelle, which is smaller, it is closed by 2 months, 3 months. This larger one, it takes 18 months to 2 years to be closed. And it will become suture like this. Yes?
Can we understand that there is very space inside, so the brain won't be harmed?
Brain still, in your adult brain, there is a space between bone and the, yeah, similarly. So there is a space. Molding doesn't mean that completely, no. Slight, just to allow a smooth birth. Okay? So this is the newborn baby. At birth, the flat bones of the skull are separated from each other by connective tissue, the sutures. At point where more than two bones meet, sutures are wide and called fontanelles, anterior and posterior fontanelles. We talk about this. Suture and fontanelles allow the bones of the skull to overlap during birth. This overlapping is known as molding. We already talked about this. Size of the vault is large compared with the small facial region at the time of birth. The face is very small, but the head is larger. Why? Why? There are no teeth, so face is small. There are no teeth, isn't it? The face is small. There are no air spaces. There is no maxillary sinus. There is no frontal sinus. There is no other sinuses. So the face is small. When the baby is growing, teeth erupt, face becomes larger. When the baby is growing, after 12, 13 years, the sinuses they develop, the face becomes larger, isn't it? What age these sinuses are complete? Sinus, air spaces. You know there are air spaces in the skull. Don't you know?
You know the one in the in here.
Not here, not here. Here. Inside the nose, inside the other bones, frontal sinus, maxillary sinus, air spaces. They allow aeration of the skull. They keep or make the weight of the skull lighter. They put resonance in our voice. Resonance. What is resonance? Echoing of the voice. In the children, there is no male and female similar voice in the children, isn't it? When they get elder, these sinuses develop, the voice changes due to this. So, this is why the size of the vault is this, the upper portion of the skull is large compared with the small facial regions. 16, around 16. Compare 15, 16, 17, like that. Anterior fontanelle usually closes at 18 months, whereas posterior fontanelle closes by 1 to 2 months. Bones of the vault continue to grow even after birth. Brain is also growing, so bone of the birth also growing. Later on, they fuse together. By 16 years of age, they are completed. You see, face is smaller than this, isn't it? Why? Now you know. The cartilaginous neurocranium or chondrocranium of the skull initial consists of the number of separate cartilages. The base of the skull is formed when these cartilages fuse together and ossify to become a bone by endochondral ossification. As I told you earlier, this is the base of the skull. Initial stages, it consists of several smaller bones. Gradually, during the embryonic life, these bones, they fuse together to make single bone. It appears like single bone, but it is a contribution of several bones. So in this way, the covering of the brain is formed, the chair of the brain, bed of the brain on which the brain rests, it is formed. Any question until here? Thank you very much. Very attentive, I need you now. Let's talk about vertebral column. One more thing I just forgot. Consists of the bones of the face. There are two areas in the, actually there are four in number, what we call them, pharyngeal arches. The bones of the face, they actually develop from those arches. Most of the bones of the face, they develop from the first and second pairs of the pharyngeal arches. And the names of these bones are written: maxillary process, zygomatic bone, and mandibular process, maxillary bone. Okay, mandibular bone, mandible. They all develop from the first arch. Second arch, it forms incus malleus. What are incus and malleus? In the ear, we call them ossicles as well. Okay, so these bones are formed from the second arch. So in this way, the whole skull has been formed, including the face. Wake up. Wake up. Okay. Now what? Vertebral column. The vertebral column is formed from which area of the somite? Nobody. Somite has how many portions? Two portions. What are those? Okay, what is ventromedial? Sclerotome. Ventromedial sclerotome. So vertebral column is formed from sclerotome, right? Don't forget it. Vertebral column. Vertebrae form from the sclerotome portion of the somites. Somite has two portions. Ventromedial is sclerotome. Dorsal lateral is dermomyotome. We are not talking about dermomyotome at this stage. We'll talk about myotome in the development of the muscles. Okay. So vertebral column is formed from the sclerotome portion of the somite. During development, the caudal means lower portion of each sclerotom segment proliferate extensively. This proliferation bounds the caudal half of the one sclerotom to the cephalic. No, you don't understand like this. Let me explain you like this. Why this color is changed. Okay, I need your complete attention just for a few minutes. Wake up. It's very important. If you don't understand this picture, useless. You cannot never understand the development of vertebrae. Extensive attention for few minutes, right? What is written here? Sclerotom. You know what is a sclerotom? Okay, it forms the vertebrae. This is one sclerotom. This is not a cord. This is one sclerotom, isn't it? One cube. One cube. This is one sclerotom. How many colors it has? Two, right? This is what? Another sclerotom, isn't it? How many colors it has? Two. This is another sclerotom. How many colors it has? I'm not crazy, I'm just wanted you to be attentive. That's why I'm asking again and again. This is one sclerotom, this is another sclerotom, this is third sclerotom. There must be fourth, fifth, sixth, above, like that, isn't it? Two colors. This sclerotom grows here in this area. This area grows faster. The lower portion of one sclerotom meets with the upper portion of another sclerotom. This is growing here. This is growing here. When this area meets with this area, this color will come up. Look and pay attention on the picture. Don't look at my face. Pay attention on the picture. Understand or not? Yeah. Sclerotom has two colors, right? The dark color is below. The light blue color is above, isn't it? One sclerotom, when it grows in this region, middle of the colors. Another sclerotom, it grows in this region, between the colors. Third sclerotom, it grows here. When they grow, the lower portion of this sclerotom binds with the upper portion of the lower sclerotom, and collectively these two structures make a one vertebral body like this. Interesting if you understand. Worse if you don't understand. Got my point? This is one sclerotom. Cells between them grows faster. This portion will go upside, this portion will go downside, this portion will form another vertebral body, this portion will form another vertebral body. As you see in this picture, initially the dark color in the sclerotom is in the bottom or lower side, but if you see the vertebral body, the dark color is above. So two sclerotoms, they unite like this.
That means the reason to make the vertebral column less after or around the bed.
Yes. Any other question? Got it clear? And when they grow in opposite direction, these two portions, in middle there is a gap. This gap has been occupied by the intervertebral disc. Intervertebral disc. When vertebral column is formed, do we need this rod now? We have a bone now. We don't need any support. This notochord degenerates. Completely degenerates, but small portion in the middle of the intervertebral disc. This is the disc. This is the disc. In the middle of the intervertebral disc, what is there? Intervertebral disc. There is one vertebral body. There is another vertebral body. What is between them in your body? Cartilage. Okay. What is there in the middle of the cartilage?
The spinal cord.
There's like nucleus.
There is a like nucleus. What is that? Nucleus pulposus. You know about this? What is nucleus pulposus? Nobody knows. One vertebral body, another vertebral body. What is between them? Cartilage. This cartilage has a gap in between. This gap is filled by a gelatinous material, gel-like substance. This gel-like substance is known as nucleus pulposus. If I jump here, this intervertebral disc and nucleus pulposus gives cushion-like structure. Why my body is not jerking? Why my bones are not fractured when I jump?
Make it flexible.
Cushion. Cushion. What provides the cushion? This disc and the nucleus pulposus. In the old age like me, this nucleus pulposus is drying up. This disc is also degenerating. If I jump, you know. Yeah, you want that, huh? So, this nucleus pulposus is remnant of the notochord. Notochord disappears completely, but nucleus pulposus is formed by that. Clear? This is how vertebral column is formed.
Intervertebral disc from which color?
No. No, not from the color.
How is it?
When this area, it develops, or this area, this portion goes down, this portion comes up. So there is a gap. This gap is filled up by the connective tissues. These connective tissues, they form the intervertebral disc. Okay? Sclerotome. This is dark color, this is light color. Light color goes up, dark color goes down. So there is a gap between, isn't it? Filled by connective tissue. This connective tissue, it forms the. This is how vertebral bodies are formed. This is how vertebral bodies are formed. So we can see these vertebral bodies, they appear in the larger area, they appear like this. The larger area, they appear like this. Sometimes these vertebral bodies, they are not formed completely in this area. You might have seen babies born with their, particularly in the lumbar region, spinal cord coming out. What we call it? Spina bifida. Spina bifida. Why it occurs? It occurs because this vertebral column, it is not formed properly in this area. It is not formed properly in this area. So, spinal cord lies in this area. vertebral bodies, they lie, or intervertebral disc in this area. Don't be confused with the spinal cord and this nucleus pulposus. Nucleus pulposus is here. Yes, anterior. Spinal cord is here. So if this portion is not formed properly, what happens? Spinal cord can come out. So this is what happens when the baby born. There is spinal cord projecting. You might see it's not uncommon.
Because of the change of folic acid or
Many reasons. We are not going into that detail, but there are cases, we see it, yes, most common folic acid deficiency, iron deficiency we call it. So that's why we give pregnant women the iron supplements, okay. So the condition is known as spina bifida. There are two types of spina bifida, I'll tell you later on. But just remember why spina bifida. Whenever you see such case in your life, just remember we learned this development of the vertebral bodies and it is not formed, the vertebral spine is not fused together properly, so spinal cord may bulge out in this area.
If the nucleus pulposus is the remaining part of the notochord, that means the notochord is not completely degenerated.
Yes. I said it loudly that notochord is degenerated completely, but small portion remains. All other portion of the notochord is disappeared, degenerated, but a small portion. You see, it's small comparatively. Understand how the vertebrae are developed. Understand how the if you understand this, well, later on it's only, you can even read by yourself. Simple. Now if I read, you will understand it, right? Vertebrae form from the sclerotom portion of the somoid. You know that. During development, the lower portion of each sclerotom segment proliferates fast. This proliferation binds the lower half of one sclerotom to the upper half of the next sclerotom. Lower half of one sclerotom, upper half of another sclerotom. Connective tissue cells between upper and lower parts. Why I am saying cephalic means upper, caudal means lower, okay. Parts of the sclerotom do not proliferate but fill the space between two precartilaginous vertebral bodies. They form intervertebral disc. Connective tissue, when this gap is formed, this is being filled by the connective tissues. These connective tissues, they form the intervertebral disc. We already talked about this. Notochord regresses entirely in the region of the vertebral bodies, only persists and enlarges in the region of the intervertebral disc. Here it forms the nucleus pulposus, which is surrounded by the connective tissues. These two structures form intervertebral disc. What is the intervertebral disc? Cartilage and the nucleus pulposus. Ribs and sternum, very simple. From these vertebral bodies, or somoid simply we say, the branching pattern occurs and they form the ribs. If I explain you simply, no other classification. So they develop as a branching pattern from the upper vertebrae. Why from only upper? Why not from the lower? This is all programmed, given genetic programming in our bodies. Okay, so they project as a connective tissues from the vertebral bodies and they surround our thoracic region. By this way, the ribs are being formed. Sternum, two bands of connective tissues. Two bands of connective tissues in the anterior region. They are formed. They fuse two bands, they fuse like this. The upper portion fuses first, lower portion fuses later. They make a single band and this single band, later on they become cartilage, later on it becomes ossified and becomes the bone. In this way, how ribs and sternum are being formed. Two sternal bands you can. Ribs form from costal processes of the thoracic vertebrae and are derived from the sclerotome portion of the mesoderm. Okay. Spina bifida, I already told you about this. When the vertebral column is deficient, the spine is not fused together, the space is left. When the space is left, the spinal cord comes out. The spinal cord comes out. As I told you earlier, there are two types of spina bifida. One is spina bifida occulta, another is spina bifida cystica. Where is that? Yeah. If the bony defect is covered by the skin and no neurological deficit occur, called spina bifida occulta. Although it is not fused together, but skin covers it and baby is absolutely normal, no bulging, but defect is there. The defect is there, but baby is normal. This condition is known as spina bifida occulta. But if spinal cord is projecting a lot and you can see by your eyes, this is known as spina bifida cystica. You just remember spina bifida, that is enough for you. How about axial skeleton? Clear? Let's talk about appendicular skeleton. What is the appendicular skeleton? Girdle, girdle. Let me explain you with the pictures. Limb buds, upper limb buds, lower limb buds, right? Upper limb bud appears 1 to 2 days before the lower limb. Okay? These buds, if I say simply, grows anteromedially, in the lower limb anterolaterally, they make a long limb. You can see there is no fingers. Yeah. If this is a bud, this is the bud. This area of the bud, this area of the bud, this area of the bud, this area of the bud. It is known as apical ectodermal ridge. What we call it? Apical ectodermal ridge. In the developing embryo, very important this thing. In the developing embryo, if I cut this area, only small this area, what happens? I am not cutting the whole limb. I am not cutting the whole limb. Only this small area. What happens? The limb will not grow. The limb will stop here, not grow. This ectodermal apical ridge has very important inductive influence on the limb to converge the cells distally. To converge the cells distally. If I cut this portion or there is a defect in apical ectodermal ridge, there is nothing to converge the cells distally to make the limb, it will stop there. Ectodermal apical ridge, AER. This grows it distally. Gradually, inside this bud develop small rays inside. Outside you cannot see the fingers. Only inside these rays are present. These rays are known as digital rays. Gradually these digital rays as a finger project forward like a duct. Yes, it is covered by the skin. Later on, due to the programmed cell death in our body, these cells, they die. Fingers appear. Any confusion, ask. Let me again start it, okay? Let me again start it. Because text is, you can read it. Explanation is important. Upper limb bud, lower limb bud. Upper limb bud appears 1 to 2 days before the lower limb. You can see no fingers, nothing, no toe. Only a plate-like structure, okay? This plate-like structure at this end here, small ectodermal ridge, which is very important. This ridge is known as apical ectodermal ridge. What is the function of this ridge? Collect the cells distally to influence the limb to grow distally. Both right and left limb, lower and upper limbs, both. If I cut it here, during this period, this limb will be shortened, it cannot be grown. Gradually, when it becomes slightly larger, inside this, some rays appear, digital rays. They don't appear on the surface. Gradually, they force influence on the surface, comes forward, but they are connected with the skin folds. Due to the program cell death between the digits, these fingers, I have seen babies with the skin present. We separate them. There's
no background between them.
Sometimes happens, something wrong went inside. Maybe mother taken antibiotics, it interferes. Right? There are many factors. Understand? This is how the bones of the limbs are formed. Let's read it. Appendicular skeleton consists of pectoral, pelvic girdles and limb bones. Connective tissue or mesenchymal bones formed during the 5th week in the limb buds. Chondrification means cartilage, formation of the cartilage. It is known as chondrification of connective tissue bones. Mesenchymal bone models occurs in the 6th week. Limb includes caudal and pelvic girdle comprise the appendicular skeleton. At the end of the 4th week, the limb buds become visible as outpouching from the ventrolateral body wall. We talk about the limb buds from outpouching. Forelimb appears before the hind limb. Upper limb appears before the lower limb. Initially, the limb buds consist of a connective tissue core derived from the somatic layer of the mesoderm. Later, it forms the bones and connective tissue, nothing important. Apical ectodermal ridge. Ectoderm at the distal border of the limb thickens and forms the apical ectodermal ridge. This ridge exerts inductive influence on adjacent mesenchyme. Influence, bring cells here. As the limb grows, cells farther from the influence of the AER, ectodermal ridge, to differentiate into cartilage and muscles. They are growing and they are converting into cartilage and bone. In this manner, development of the limb proceeds proximo-distally. Like this. In 6-week-old embryos, the terminal portion of the limb buds becomes flattened to form the hand plates and foot plates. Initially, the plates are formed. Digits are not formed. Fingers and toes are formed when cell death in ectodermal ridge separates the ridge into 5 parts. Condensation of the mesenchyme to form cartilaginous digital rays and the death of the intervening tissue between the rays. This picture explains everything.
Cartilage, not the bone.
Initially, it's cartilage. Initially, it is connective tissue. Then it is converted into cartilage. Then it is ossified into the bone. Okay? Rotation of the limb. Again, it is a very important point. Just look at me. Don't go there. When the baby is forming, the limbs, they develop in this way. Is this the anatomical position? No. What is the anatomical position? This, isn't it? And legs are like this. So baby is growing like this. What we need? What we need? Rotation. Rotation of what? Upper limb. This is 90 degrees, right? Upper limbs rotate 90 degrees laterally. Lower limb rotates. This is known as rotation of the limb. Sometimes baby is born without rotation of one leg or both the legs. Then we struggle for the rotation after birth. I have seen such cases. This is rotation. Very important event. Upper limb rotates 90 degrees laterally so that the extensor muscles lie on the lateral and posterior surface and the thumbs lie laterally. Lower limb rotates approximately 90 degrees medially, placing external muscles on the anterior surface of the big and middle toe like this. Simple. Limb growth and development. All story. All story. Just look at this picture. Now when the limb is grown, you see different stages. Forearm, there are two bones, radius and ulna. Primordium. These two bones, they all are connective tissue first, then they become from the midline, they become cartilage, and from their cartilage they become ossified to become the bone. Middle of the bone becomes ossified first, which is known as diaphysis or epiphysis. Diaphysis. And the ends of the bones, they ossify. In the end, they are known as epiphysis. Why? Why not together?
It needs to articulate with the other bones.
It needs to articulate with the other bones. Baby is born with this much bones. Baby is born with this much bones. They have to grow. So both the bones from the epiphyseal plate, in epiphysis there are two plates on both the ends. They grow the baby. During childhood, if baby break his bone, if the baby break his bone in the epiphyseal area, this plate, epiphyseal plate, or this area, this bone will not grow. If 6 years old baby fall down and the fracture occurs in this area, it will not grow. Because these are the growing ends, epiphysis, they are growing ends. Ossification of the bone start from here and extend into the ends of the bones or epiphysis. Similarly, joints, very simple. Joints. Collection of the cells occur, for example, elbow joint. Collection of the cells. Many cells, they occur here. Now they start to die. They die to the extent where cavity of the joint is formed. Programmed cell death has many importance in the human body. If this programmed cell death does not occur, human cannot be formed normally. Similarly in the joints, similarly in the lungs, in the blood vessels, in the GI tract, these cell death, formation of the cells, then programmed death of these cells, it is very important. Similarly, many cells of the connective tissue, they collect in the joint area. Gradually they start to die. They die in such a manner that the cavity of the joint is developed.
If the fracture happens in the epiphysis, he will become disabled?
Not disabled, the bone becomes shorter. Not at your age, the young children, where the bones are still growing. In your age, the bones are grown up now. Your height will not go up now, isn't it? So if it is fractured here or here or here, don't fracture, huh? Doesn't matter. But if in the young children, 5 years old, if fractures in the epiphyseal area, epiphyseal plate, this end of the bone will not grow. Others will grow, but there will be some deficiency, isn't it? Yes. Thank you very much. This is with you. This is with you. Anytime you are welcome. Discuss with me anytime. Right? I hope you understand. It's